No medicine can remove the cause of a lifestyle disease, but you can. Welcome to this final episode in the 4-part series on heart disease. In this final episode, we will be looking at how clinically supported lifestyle correction can play a major role in treating heart disease. In the first episode, we had looked at what is heart disease and what causes it. In the second, we had seen what are the latest treatment options available and what is the plus and minus of them. In the third, we had seen the complications related to heart disease which are not often noticed with care, and at the same time also the associated diseases that often come together with heart disease and really require parallel treatment. In this fourth episode, we begin with what exactly is clinically supported lifestyle correction when compared to lifestyle correction in general, which people understand as something that can be done by themselves.
So basically, for the heart patients, the lifestyle correction heart patient, the doctors will advise, usually send the patient to a dietitian, and they will be writing it, giving a diet chart, like 2 idlis, 2 chapatis, and this is portions and all will be there. And the patient also doing some exercise, going for walking or swimming. That will be the pattern. There will be usually the people their understanding will be that, and hypertension, reduce on salt and reduce on oils. That will be the general understanding. But that simple understanding is not sufficient for a cardiac patient who's on medication, and most of the heart patients will be on diabetic medication, hypertensive medication. And in such patients, the role of clinically supported lifestyle correction is there. In the clinically supported lifestyle correction, it is I don't know where any other places in the globally any other center other is giving the way I am giving the patient to the for the clinically supported lifestyle correction. In this, actually, what we are focusing is to initially understand the patient's specifications, give a detailed analysis of the patient's system and the body composition, and we are trying to correct the body composition macro level and at a micro level, that is at the cellular level. So that is why if the patient is that heart patients will be having so many other diseases also. We are focusing to correct each cell of the body. So if it's not the heart cells alone is corrected, it is not the blood vessel alone is corrected, it is not the pancreas or the skin alone is corrected. So every body part is getting a benefit. Every cell in the body is getting a benefit. So for that, we had to understand the patient, detailed body parameters has to be assessed, and also how their lifestyle also. We should be able to do what they eat and what exercise, what physical activity they are doing, and also the mental activity, the patient sleep pattern, everything we will be getting an idea and give a direction. That is why I'm able to do one patient may be heart patient, but that heart patient itself will be having so many associated disease. Other patient may be having arthritis, and arthritis patient also will be having heart disease and the diabetes and hypertension, etc. So everything can be corrected if you do the correct nutrition, correct exercise, that is physical activity, and the mental activity also to be corrected, and also reduce the toxin level. And along with all these things, one of the most important nutritional imbalance what we are having is this omega-3 deficiency and excess omega-6. Because of the new diet pattern, the omega-6, that is an inflammatory fat, is very high in people with especially with these diseases, and omega-3 will be very low. So we have to correct that imbalance also. Because of this correcting and taking measures to correct all these aspects, we are getting the result, and all the symptomatic relief will be parallel for everything. And we'll be following it also, because initially we are doing a detailed analysis and finding out which food is correct for the patient and which is reacting, and such details also will be taken. And we will be for this cardiac patients, will be following the troponin. If it is high, every week it will be checked. And also the HSCRP, CRP, even inflammatory markers like blood count and ESR also will be high in many of these patients. And cholesterol, definitely cholesterol and lipid profile will be checked. And many will be having so many deficiencies like vitamin deficiencies and mineral deficiencies like zinc may be low. So we'll be checking over the nutritional imbalances also. And if it is one of the most common is vitamin D deficiency. And many of them will be, I must have in our part of the country, if they are not taking vitamin D supplements, almost 95% will be deficient, and many will be having almost 50% will be very low vitamin D levels. So that all will be a part of the disease process, nutritional deficiency. So correcting the nutritional deficiency and the toxin level. I'm seeing so many patients with high tin level, arsenic, mercury, and such things also. So trying to correct that also actually. So with that, when you are so holistically, when we are looking at and correcting, and the patient is cooperating, they will be getting the result. And most of the patients will be able to come out of all the medications within all this diabetes, hypertension, heart disease, and all within a month, except those who are on put on stent or pacemakers. If the patient is already on stent, they have to continue blood thinners for a year. And if they are pacemaker, they have already put, they had to continue the blood thinners lifelong.
Actually, you often say that, for those who are after a checkup, testing and all that, they find that their BP, their cholesterol, their sugar levels are in control. But they should actually check their inflammation levels, their insulin resistance and all that. Then only, they can really get to know about their heart risk. So when someone tests and finds that, that they are having some borderline issues and all that, normally it goes into medication. So at that initial stage, what should patients know about this clinically supported lifestyle correction, whether it will be of any use to them at that stage?
They are interested. It is actually I'm giving like this clinically supported lifestyle correction not for the sick patients alone. Actually, I'm giving for the infertility patients or for the those who are interested pregnancy planning. They are not having any sickness, but the patients who want recently this young generation, many of them want to have only one or two children. They want a healthy child. In that case, we assess and find out any problem which is correcting. And after 3 months clinically supported lifestyle correction, then with the monitoring, they'll be trying for the pregnancy. And the pregnancy time also, it can be continued. So what we are actually learning is a healthy lifestyle. So you need not be sick or not on the end stage, you have to come for it actually. It is earlier the best. And if you are overweight, there are patients coming there, they don't have much of the problem, they want to reduce the weight. They have only hypertension. I have patients who are saying they're only hypertension, but they want to correct it. I have a patient who was come down from another country. She's actually, such patients are rare, but she has come out with hypertension, and even with the medicine, one or two medicines also, it was not controlling. It's very young lady. And she came down and stayed here for a month and corrected it, gone back. And following it up also currently also. And other patients are very sick also. And I remember one cardiac patient, for example, and they come down from US actually. He's telling that last year he was undergone a bypass surgery. They wanted to come here, and he didn't want to go for the bypass surgery. And he is following the videos and all very well, and he is very aware. But his children are two doctors are there in the family. They didn't allow. So he was undergone the surgery, bypass surgery. They called and they were taken appointment, but the children blocked it, and he has undergone the bypass surgery. And this year he is having severe. He cannot walk at all. Even if he flew steps, he find it severe pain. That is claudication pain on this. That is peripheral vascular disease. He's just like his heart, his peripheral arteries also, this arteries also having this block is there. And also the two blood vessels are taken for the bypass also. The way venous circulation also is affected. because after the surgery, his major problem is not able to walk, severe pain on the leg, and also muscle cramps. Because of the muscle cramp, he's not able to sleep also. This time again, they have consulted there. This asked for putting stent. Then he decided to, without much of the support from the children, he decided to come down to Kerala and started lifestyle correction. He was having a not very obese, but he's having a very prominent tummy. And his wife was very supportive. She's also in the medical field. So wife was very supportive. So he found at least one person to support him, and they decided they wanted to go back after a month itself, but they decided to stay for 3 months, and now it is, I think it is almost there. Everything within first month itself, he is taking diabetic medicine, hypertension medicine, statin, all the standard medication, all are there. First month itself, he is out of the medicine, and now they're confident. They were worried about how they will be following it with the blood test and all. They're worried when they go back to US, because they had to go for the regular checkup, but they cannot do the other test. And their confusion also, many patients' confusion is what will they say to their doctor. If they say that they are stopped medicine, even if everything is normal also, the doctors will not be happy, and what will they to do? Even here also the same problem. So what will they ask them to tell the doctor that everything we are taking all the medicine. The medicine is for the sugar or pressure, or if the parameters are all okay, the doctors will be happy. That is the only way they can go for that. If the parameters is not, the patient should keep the lifestyle and keep the parameters correct. Then they don't have to worry about it, and no need to make sure that do the checkup, and at least what is available, they do it and make sure that they are correcting, getting the correct reports. That is it. And usually the doctors will also be, they'll be thinking that because of the medication they are giving, but the patient is corrected the blood parameters, HbA1c and all. They may be having a very high HbA1c in the beginning, but after stopping the diabetic medicine, the blood pressure and the BPN will be much better than the previously with the medication. That is the important, that the beauty of this clinically supported lifestyle correction.
You have said earlier also that after one stent, if a patient is asked to put the next stent, some patients feel that something is not correct. That's why they are needing it again. Because initially they may have only thought only one is needed, and then they will be okay because they will get a sudden relief and then everything is fine. So, to such patients, how does clinically supported lifestyle correction fit in?
See, those patients who are coming to me has undergone many years, one or two times foot the stent. And I remember one lady, it's a comparatively young lady around 55 or 60. In the last 2 years or 1.5 years, she has put 2 or 3 times stent and balloon angioplasty and bypass also. And again, she was asked to repeat bypass surgery actually 2 3 times, and one time actually because of this balloon angioplasty, there is some ballooning of the coronary artery also happened, because the coronary artery also has thinned out. That balloon area, it is thinned out, and if it is rupturing that coronary artery, if it ruptures, it is a big problem actually. And this patient, that is the multiple, I don't remember exactly how many procedures she had undergone. In that stage, actually, she was asked for multiple stenting, balloon angioplasty, and a bypass, and again for the she's asked for it. That time she came to me, and it is actually within a month the same way, because the last stent was put only 7 or 8 months back, and the last procedure was actually balloon angioplasty. So she was able to come out of all the medication, all the other than this blood thinner, within a month itself, and she's comfortable and without medication. She was also hypertension and diabetes and all was there, and obesity also was there. And we always ask the patient to come to the low normal BMI. Try to come to the low normal. Everyone thinking that the 25 is the normal BMI. No, it is not like that. Especially this within the sedentary habit. For Indians, it is around 18 or 19, depending on the muscle mass, muscle and bone mass. Is always come to the low normal BMI. That means the less fat is there. So you have to give place for this internal this blood fat deposited in the blood vessel has to come out only if the fat in the adipose tissue and the liver, fatty liver has to go, and the adipose excess fat in the body has to leave. Then only this fat deposited in the coronary arteries and all the blood vessels and come out. That is the thing. So I had treated patients with bypass surgery and multiple stenting. And everyone the same. Only thing, if you come early, when you are asked for an angiogram itself, if you come, you will be served from the angiogram also. If you come after the angiogram and stent, again the same procedure. If you come after the bypass also, this as I said earlier, the undergone a bypass surgery, but now is peripheral artery disease, the blood vessels in the leg is affected, again the same thing. So you can, if you come at the earliest, you will be the less procedures you have undergone. If you go for a this bypass surgery, how much pain you have to bear? As a major surgery, the wound is there, here and the wound is there, and the leg, both the legs will be wound, long wound will be there. You imagine everyone will be suffering that. Why you are, if you start a clinically supported lifestyle correction in the earliest, your suffering will be less and your medications will be there. You are taking medications, so much of medication, you will be suffering always with the tummy will be under trouble. And so many weeks, actually, only after these medications are over, the patient will feel the freedom. They'll be, and I had seen patients who are advised to bypass surgery, and even after that, they're going for trekking and trip, and they're saying that, doctor, I had gone to Munnar and or even those who are going to this Leh and Kashmir and for the trekking and all, they're finding it very comfortably coming back. I was even with that cold in Kerala, it is very hot climate, and they're going for this the Himalayas and all, they're very cold, they're able to do that. Those who are advised for bypass surgery and all. And even after that also, they are regaining the health. And the most important thing is, even the body age, we are looking in the beginning itself, we are looking in the body age also. Many people today, these heart patients will be having accelerated aging. They may be only for 45 or 50, but the body age will be at 70 or 75. It is 10 or 15 years accelerated aging, and that also will come down. The body age, we can actually, if you are 50, you can keep it at 45 or 50, 50, you can 45, or even the patient, they're coming initially, they may be 50-year-old will be 65. But after if you are following it up correctly, they can come down below 10 or 5 or 10 years younger than that. That is the beauty, and the patient will be feeling it also. That the youngness, this aging reversal, accelerated aging reversal, this anti-aging effect of this clinically supported business, they'll be able to feel it clearly.
You often say that, the most important thing that everyone should understand is the role of inflammation in heart attacks. And generally, heart attacks take place always with some sort of inflammation linked to it. But at the same time, general treatments like medications or even this surgical interventions like angioplasty or bypass or whatever, they don't address inflammation. And you also say that those medications that are given for inflammation also, over a period of time when they are taken chronically, they actually contribute to inflammation also. So in this context, what is the importance of correcting one's lifestyle, and what is its role in inflammation?
All the surgeries are actually making inflammation. The disease, lifestyle diseases, on all the diseases, even the infections, it is actually inducing inflammation in our body. So all the lifestyle diseases, include the heart disease, is an inflammatory disease. When you are putting a stent, it's your minor scratching and all will happen inside your blood vessel also, because there is also this atherosclerosis and plaque fat deposits will be there the whole length of our blood vessel. And if you are entering through the arm or at the groin, you have to travel all this way up to the heart. So you will be making some damages there. So the inflammatory level will be high, and there will be excess chance for blood clot, because the inflammation inside the blood means the blood clot can formation will be there. That is why the high level of high dose of anti blood thinners are given. So when you are doing a surgery, you are inducing inflammation because you are cutting the bone and cutting the whole chest wall and also cutting the leg for vessel harvesting. So the inflammation you are inducing actually with each surgery, the inflammation is actually high, and that is why the anti-inflammatory, the painkillers will be given for that. So when the painkillers is given, actually you are healing. That is anti-inflammatory medication will block the healing process also. That is why when for the lifestyle diseases we are giving medications are all anti-inflammatory. That will prevent healing. All that is also medically itself. This research also has proved that if we are taking too much of anti-inflammatory medication, if the bone healing, if after a fracture bone healing and the wound healing and all will be affected. So this healing process will be blocked. That's why we are trying to reduce the medication at the earliest also. If you are not able to reduce the medication, that anti-inflammatory, that full effect of what the nutrition you are taking, that is to heal your body, the repair your body, that repair will not take place in the correct way. If you are continuing with this cholesterol statin medicine, your repair will not take place properly. Why? Because for the repair, a damaged cell has to be replaced with a new cell. For making that new cell, the cell membrane is a major part of it. It is giving the skeleton for the cell and all the organelles. So for that, this cholesterol is a very important thing. And if the cholesterol level you are artificially reducing, then how can the body can heal or repair itself? Because the essential nutrient for the body building is cholesterol. So one of the, not the single element, it's one of the major element is cholesterol. So if you had to give a atmosphere with all the essential elements are there for the repair of the body, that will be supported by all this medication.
Actually, nowadays it is generally felt that statins are a solution for our cholesterol issue. But at the same time, we understand that it is not statin deficiency that is causing cholesterol. So, what is it that patients should understand about statin and their general lifestyle?
If you take statin, the problem is you may be. I have seen many patients with very low testosterone level. I don't check with the progesterone and estrogen, so I don't know because it's estrogen and progesterone are checked only for the when they're looking for the reproductive health and all. But generally, men will be checked with testosterone also. I have seen many patients with very low testosterone level. They'll be having very low sexual drive and all. But with the clinically supported lifestyle correction, within weeks itself, they'll be get corrected. Not with any supplements. Otherwise, if the testosterone level is low, what is the treatment? The supplement with the testosterone injection or tablets. But no need. Actually, the testosterone will gradually increase to the normal level within weeks itself. And the hormone changes, actually, the correction, it is very fast. Actually, this insulin resistance, it is corrected very fast, actually. Usually, the high insulin, this type 2 diabetes patient, the high insulin, the 8th day when we come itself, it has drastically come to normal. That means the insulin resistance can be cleared within days itself. Most of the patients, anyway, definitely it will be reduced. Whether it is reached normal or not is depends on the initial level. But very fast, within 2 weeks, definitely the insulin level will be reduced. That is what I'm saying. If it is not reducing, then we have to see that whether any insulinoma or such things. Because of the insulin resistance problem, it will be this regular type 2 diabetes insulin resistance will be corrected within days itself.
What's your message to a patient who has to decide, how he should go about his treatment when he knows that he has blocks in the heart and they are of serious nature, but not of emergency nature?
If it is in any patient, if they are able to stabilize themselves, if they get an attack also, if they are able to, if in the coronary, this intensive care unit with the medication, you can stabilize yourself. And the bypass surgery, as you know, if it is, if at all this angiogram is done, if a stent is, if not able to put the stent, next is angiogram and this bypass. It will be taken place only after a few months only, and there will be many will be in the waiting list also if it is in the government sector. So those people, if they are willing for the lifestyle correction, they can come out of it. And it can be very clearly, you can see that this usually this coronary, this cardiac specialist and all will be checking only few items like troponin, whether it is an thing is a ECG. Even a CIMT test is not done in many of the. I have seen not seen any patient coming with a CIMT report. Only if after seeing my videos and all, they may check it. A few patients come with a report because they are asked for it. In our part of the country, no one is looking for this. It's a quite a non-invasive procedure to see what is the condition of your blood vessel. We'll be, if it is previously checked or not, we'll be following it up, say checking it yourself. And by even this waiting time, you can see what is happening to that. And the cardiac, this patient, actually those who are needing a bypass surgery is only those who are finding it very difficult to do the daily activities. If you are not able to do your daily activities like taking a bath or combing your hair or such things, only this bypass surgery is beneficial. Or it's putting stent also. The real benefit is there, but in that those patients will not be fit for a surgery also. You should understand that if the patient is hypertensive, if the patient is diabetic, if the patient is having a low cardiac output, then they're at high risk for anesthesia itself. And on this table, complications can be very high. So if when there is, and even after doing all that, your diabetes and hypertension and all the problems and all the other blood vessels, you'll be putting only one stent only or bypassing one small artery in the coronary artery. But the problem is there throughout your body. Your kidney will be, the liver and kidney and the leg, everything will be affected. So you are only treating only a part, and you have to continue with all the medication, all the medicines you are taking, and also extra medicines after the surgery. And also for the you have to suffer all the pain of the bypass surgery. It is really a matter. And all the patients, especially the obese, also they'll be having some arthritis and degenerative knee disease. This problem will be there, and those things also will be corrected with this. And you can get if you are obese, depending on the patient, if you are obese, you can get that 20% weight reduction. That is that weight reduction means it's a fat reducing, and fat reduction also along with this. So that is why it is a simple and complete solution actually. If your body is having reasonable health, if your heart is already under cardiac failure, and if your kidney is already failed in the fourth stage or fifth stage of renal failure, then you should not expect a complete, but regaining full health and all, depending on the body's health, body's repair capacity. The repair is possible depending on the body's repair capacity, age, and other parameters. But generally, it will be much better than going for this lifestyle disease medication and surgery. It will be much better, definitely, with the lifestyle diseases, the lifestyle correction. And also, this lifestyle correction you can do, but if it is not working only, you can definitely, the medicine and the surgery options are there. The first, in all the medical first line of management is lifestyle correction. If the lifestyle correction is not effective, only you need to go for other things. And if the patient is able to understand, because the whole medical world and all over the world, it is thinking in a different way, and no one knows about this, the proper way of lifestyle correction in a systematic way. If you do it in a systematic way, you need not go for any of this, and you can see it within a month. That is you can see the changes within a month. I am not saying that the lifestyle correction is needed only for 1 month. Lifestyle correction is needed throughout your life, but the teaching and the support is needed. The teaching process itself is around 90 days, and you may need the complete support partially, at least checkup will be needed, and to see that it is not going in the correct direction, especially those with this atherosclerotic plaques with calcification and all. It will take monitoring and all, following it up and support for 2 or 3 years itself until it is getting corrected.
You also say heart transplant is not a failure of the heart, but it is the failure to act early enough. So with this, we come to the end of the 4th episode of our series on heart disease. In the earlier episodes, the first one we saw the cause and nature of heart disease. In the second episode, we saw the basically the latest available treatments on heart disease. And in the third one, we saw the complications of heart disease and the comorbidities associated with the heart disease. And in this final episode, we saw how lifestyle correction can make a major difference in treating heart disease. Thank you. The informed patient is key to treatment success.